So many of the patients that are in BDA program are the patient kids, for example, that cannot walk or, for example, cannot sit, but they can sit, but or they can sit, but in a very with not such a good balance. So I'm going to explain a little bit how BDA can help with the kids that have this kind of issues with sitting. So it's a very generalized, let's say, question, because many kids have a different kind of problems for the sitting. But I'm going to explain some things which we can kind of connect with the majority of the kids that have difficulties with sitting. So first of all, for the sitting, it's very important the counterbalancing reactions. So the counterbalancing reactions basically mean this. So we can say the child is sitting, and while the child is sitting, the child, of course, need to change the position. So this position is changing all the time while the child is trying to grab something, or if the child moves the head, it also happens something with the child body, so the child needs to counterbalance. So this kind of counterbalancing can come from two sources. So one source is, for example, actually more sources. So one source is if the child is using the arms. So basically the child is just using the arms and it's creating like a triangle. So the child is going to sit, bend the body forward, bring the head forward and put the arms down. So the child is basically creating the triangle of its own body. So when the child creates a triangle, basically the child make the arms very stiff and then just use the arms for the support. The problem with this kind of sitting is that the child simply is not able to do anything else. So if the child cannot raise the arm, if the child tries to grab something, eventually it's going to fall. Another way how the child, more advanced way how the child can sit is if the child is using the counterbalancing reactions with the upper part of the body. So this is the situation when the child is going to bend, if the child pelvis is moving to the right side with the upper part of the body, the child can actually balance the body and bring the point of gravity to the other side. So let's say that the child is doing something, the child feels that it's losing the balance, then it's using the head in different ways, using the arms in different ways in order to balance the sitting position. So this is a little bit more advanced way for sitting, because in this situation the child can still actually use the arm, but when the child is using the arms, he is going to twist the head, excessively use the other arm in order to kind of grab something and to do something with the arm. So it's a bit better way of sitting, but not so energy efficient, because the child still have to think too much about sitting, and it's very difficult then to actually make any kind of a coordinated movement with the other arm. And then we have, let's say, a very good way of sitting, and that is basically when the child is using the ground force reaction, or where the child is using the pelvis in order to balance the upper part of the body. And that is a more complex way, but very efficient way, because if the child is falling, for example, to the right side, let's say the child is trying to grab something, we give the child something and the child is using the arm in order to kind of take the ball, he is bringing his point of gravity more to the left side, and of course he have a tendency to fall to that side. But instead of falling, the child is going to use the pelvis, and with the pelvis and with the legs it's going to push that part of the sitting platform, and thanks to that he is going to push himself to the other side. But when he does something like this, he also needs to have a very good connection with the whole torso and the back with the pelvis. So basically, the child is manipulating with the upper part of the body by using the pelvis. And this is quite an advanced way of sitting, because then the child can completely free up the arm and the head and can do different things with the arms, bend to one side or bend to the other side, but at the same time just move the pelvis and balance himself. So we can say that this is something which is a big goal in order for the child to achieve a good sitting position. In most of the cases, the child is using the arms, or the child is going to twist the upper part of the body and use mostly the arms. And in most of the cases, we see this kind of problem with the kids that have genetical disorder, or the kids that have different kind of cerebral palsy conditions. So, what is BDA doing in this situation? Well, first of all, these kids can have different kind of problems. First of all, at the level of the tissue responses, they could have a very soft torso, for example. So, for example, if the child relaxes his own body, so the child relaxes his own body and he basically put his chest on his stomach. And if the whole torso during this compression is very weak, the child is not getting enough of the tension in the, which he can use in order for the support, so the child constantly feels that it's deforming and falling down. So then the child have to use excessively the muscle effort, and if the child let go the muscles, if the child relax the muscles, it is just falling down. In this case, the BDA is focusing on the reactions of the tissues in the torso area. So basically, when the child relaxes, this micro movement which happen in the body should increase the inner connective tissue tension, which the child can use as the support. So basically, the child should first be able to relax and that the torso hold. If the child is, for example, hypoton child, when the child relaxes, everything just deforms. The chest deforms, stomach deforms, it can also bulge, and in this situation it can happen that simply the child is losing the balance and constantly feeling like it's falling down. So if we want to reduce the muscle tension with which the child is overusing in order to compensate this kind of problem, we are increasing the overall tensional integrity of the torso. So when we have the tensional integrity of the torso, then we can move to the next step, and that is basically the counterbalancing reactions of the spine. So if the spine is very stiff, if the child is not able to make this kind of movements of the spine, we have many exercises which are very good for the development of the spine, which in time are allowing the child to have better mobility in the spine, which the child can use in order for counterbalancing reactions. And then on the end, when we have all that, when we have the mobility, when we have a good tensional integrity, we can go into the force distribution. We call that basically force distribution is ability of the child to use one part of the body in order to manipulate with the other part of the body. How to distribute the load of its body from one area to another area. And we are slowly coming to this way of sitting. So that is basically when the child can lean his body weight to one side and then work with the floor in order to push himself in the position where he wants to be. So on the end, I'm going to show many different examples of how the kids with different kind of conditions achieved better sitting position and sitting. Some examples. Before she was excessively using her arms, which are positioned forward, and now her arms are more closer to her pelvis. So this means that she had to use more her upper trunk. At the same time, we can see better mobility of the spine. Before, when I was trying to make a movement with the child back, the spine was stiff, and now it's more easier to make the movement of the spine. We can see on this test a very similar story. I was able to make a much bigger curve in her back. Better mobility of the spine is allowing the child a better counterbalancing reaction. So on the left photo we can see when the mother was moving the child pelvis to the side, the child was reacting with a stiff torso, with no movement in the back, and here we can see better counterbalancing reaction. And she was also much better in using her arm comparison how it was before. Previously, she was constantly trying to use both of her arms, and she did not use so much her counterbalancing reaction of the upper part of the body. Here we can see another example. The photos speak for itself. So previously the child had a very big problem with any kind of counterbalancing reaction. The torso was very soft, and when the child relaxed, everything just deformed and slide. Now the torso is much more stronger, and we can see when I was trying to move the child, he would just excessively deform, and now his trunk is creating much better resistance, and he's much more stable in the sitting position. Here is some more examples of the sitting, and we can see previously the child had big problems with the head control and the trunk stability. She was overreacting with the upper part of the body, while now we can see that she is much more stable in the sitting position. So she is now using her arms quite a lot, but even before she was trying to do it, but since she had very, very weak stability of her trunk and no head control, she was not really able to keep the sitting position as this for a long period of time. She was constantly losing the balance and reacting with panic. Now her head control is much better and the whole sitting position is improved. more examples. The child previously had a problem to sit even in the parent's lap, under the parent's control. And we can see improvement of the sitting as well as the head control. The trunk is much more stable and the head control is stable, much more stable as well.